Hello everyone, welcome back to NCLEX Made Easy 91. Today we'll be going through endocrine system NCLEX style questions with detailed rationales. This session is designed to sharpen your test-taking skills, help you understand the why behind each answer, and prepare you for success in your exams. So grab your notes and let's dive right into these high-yield practice questions. Question 1. Which of the following is an example of an endocrine gland? A. Salivary glands, B. Sweat glands, C. Pituitary gland, D. Lacrimal glands. Answer C. Pituitary gland. Rationale: the pituitary gland is a key endocrine gland, while salivary, sweat, and lacrimal glands are exocrine glands. Nursing strategy: educate patients about the pituitary's role in hormone regulation and monitor for symptoms related to hormone imbalances. Question 2. The hypothalamus connects the nervous system to the endocrine system through which gland? A. Thyroid gland, B. Adrenal gland, C. Pituitary gland, D. Pancreas. Answer C. Pituitary gland. Rationale: the hypothalamus is the part of the brain that connects the nervous system to the endocrine system via the pituitary gland. Nursing strategy: understand neuroendocrine function when assessing patients with pituitary or hypothalamic disorders. Question 3. What is a hormone? A. A type of enzyme that breaks down food, B. A chemical messenger that travels in the bloodstream to target cells, C. A structural component of cells, or D. A nerve cell that transmits electrical signals. Answer B. A chemical messenger that travels in the bloodstream to target cells. Rationale: hormones are chemical messengers secreted directly into the bloodstream by endocrine glands. Nursing strategy: educate patients on hormone therapy and monitor effects of hormonal imbalances. Question 4. What is the primary function of the thyroid gland? A. To produce insulin and glucagon, B. To regulate metabolism, C. To control blood pressure, or D. To regulate sleep cycles. Answer B. To regulate metabolism. Rationale: the thyroid gland produces thyroid hormones, T3 and T4, that control the body's metabolism. Nursing strategy: monitor thyroid hormone levels and educate about symptoms of hypo and hyperthyroidism. Question 5. What is the main role of the parathyroid glands? A. To regulate sodium and water balance, B. To regulate calcium levels in the blood and bones, C. To produce hormones for the fight or flight response, or D. To regulate blood glucose levels. Answer B. To regulate calcium levels in the blood and bones. Rationale: the parathyroid glands secrete parathyroid hormone, PTH, which plays a crucial role in maintaining calcium balance in the body. Nursing strategy: assess for signs of calcium imbalance and educate patients on dietary calcium. Question 6. Which hormone is responsible for the body's fight or flight response? A. Insulin, B. Cortisol, C. Melatonin, or D. Epinephrine or adrenaline. Answer D. Epinephrine or adrenaline. Rationale: the adrenal glands secrete epinephrine and norepinephrine, which mediate the fight or flight response. Nursing strategy: monitor vital signs during stress or adrenal disorders and educate on stress management techniques. Question 7. A patient with hyperthyroidism is likely to have which of the following? A. Low T3 and T4 levels, B. High TSH levels, C. Low TSH levels, or D. Normal thyroid hormone levels. Answer C. Low TSH levels. Rationale: in hyperthyroidism, the thyroid gland produces too much thyroid hormone, T3 and T4, which negatively feeds back to the pituitary gland, causing it to decrease TSH secretion. Nursing strategy: monitor for symptoms of hyperthyroidism and educate on medication compliance. Question 8. A patient with Graves' disease is assessing for which finding would be most indicative of this condition? A. Bradycardia, B. Weight gain, C. X-optimos, or D. Cold intolerance. Answer C. X-optimos. Rationale: Graves' disease is the most common cause of hyperthyroidism and is often accompanied by X-optimos, or bulging eyes. Nursing strategy: monitor eye health and educate on managing symptoms such as dry eyes or vision changes. Question 9. A patient with Addison's disease has a deficiency of which hormones? A. Thyroid hormones, B. Cortisol and aldosterone, C. Insulin and glucagon, or D. Estrogen and progesterone? Answer B. Cortisol and aldosterone. Rationale: Addison's disease is an autoimmune condition resulting in a deficiency of adrenal hormones, specifically cortisol and aldosterone. Nursing strategy: educate on lifelong steroid replacement and signs of adrenal crisis. Question 10. What is a key sign of an Addisonian crisis? A. Hyperglycemia, B. Severe hypotension, C. Weight gain, or D. bradycardia? Answer B. Severe hypotension. Rationale: An Addisonian crisis is a life-threatening medical emergency characterized by profound weakness, severe hypotension, and shock. Nursing strategy: recognize symptoms early, administer IV steroids promptly, and monitor vital signs closely. Question 11. A patient with Cushing's syndrome has excessive levels of which hormone? A. Thyroid-stimulating hormone, TSH, B. Antidiuretic hormone, ADH, C. Cortisol, or D. Growth hormone, GH? Answer C. Cortisol. Rationale: Cushing's syndrome is caused by prolonged exposure to high levels of cortisol. Nursing strategy: monitor for signs of cortisol excess and educate about medication side effects and lifestyle changes. Question 12. A patient with diabetes insipidus has most important nursing diagnosis. A. Risk for impaired skin integrity, B. Deficient volume, C. Imbalanced nutrition less than body requirements, or D. Ineffective airway clearance? Answer B. Deficient volume. Rationale: the primary problem in diabetes insipidus is the excretion of large amounts of dilute urine, which can lead to severe dehydration and a deficient volume. Nursing strategy: monitor INO carefully, encourage fluid intake, and educate about signs of dehydration. Question 13. Which of the following is a symptom of hypoglycemia? A. Fruity breath, B. Extreme thirst, C. Sweating and shakiness, or D. Kussmaul respirations? Answer C. Sweating and shakiness. Rationale: sweating, shakiness, and tremors are classic signs of hypoglycemia due to the body's adrenergic response to low blood glucose. Nursing strategy: teach patients to recognize early signs and how to treat hypoglycemia promptly. Question 14. What is the most common form of diabetes? A. Type 1 diabetes, B. Type 2 diabetes, C. Gestational diabetes, or D. Diabetes insipidus? Answer B. Type 2 diabetes. Rationale: type 2 diabetes is the most common form, accounting for approximately 90 to 95% of all diagnosed cases of diabetes. Nursing strategy: educate patients on lifestyle modifications, medication adherence, and regular monitoring. Question 15. A patient with a fasting blood glucose level of 140 milligrams per deciliter would be diagnosed as A. Normal glucose, B. Prediabetes, C. Diabetes, or D. Hypoglycemia? Answer C. Diabetes. Rationale: a fasting plasma glucose level of greater than or equal to 126 milligrams per deciliter on 2 separate occasions is the diagnostic criteria for diabetes. Nursing strategy: encourage follow-up testing, diabetes education, and dietary counseling. Question 16. What is the purpose of the HbA1c test in diabetes management? A. It provides a daily glucose reading. B. It measures the effectiveness of insulin absorption. C. It reflects average blood glucose levels over 2 to 3 months. D. It indicates the risk of developing DKA. Answer C. It reflects average blood glucose levels over 2 to 3 months. Rationale: the HbA1c test measures the amount of glucose attached to hemoglobin, giving an average blood glucose level for the preceding 2 to 3 months. Nursing strategy: educate patients about the importance of HbA1c testing for long-term diabetes control. Question 17. A nurse is teaching a patient about foot care for diabetes. Which instruction is most important? A. Cut toenails in a curved shape. B. Apply lotion between the toes. C. Inspect the feet daily for any injuries. D. Wear tight-fitting shoes for support. Answer C. Inspect the feet daily for any injuries. Rationale: due to peripheral neuropathy, patients with diabetes may not feel injuries to their feet. daily inspection is crucial for early detection and prevention of serious complications. Nursing strategy: provide foot care education and encourage regular podiatry visits. Question 18. A patient with diabetic ketoacidosis, DKA, is likely to have which of the following? A. Hypoglycemia. B. Metabolic alkalosis. C. Fruity breath odor. D. Hypertension. Answer: C. Fruity breath odor. Rationale: DKA is characterized by the breakdown of fat for energy, which produces ketones. Ketones in the blood and urine can give the breath a fruity smell. Nursing strategy: monitor blood glucose and ketones and initiate prompt treatment with insulin and fluids. Question 19. What is the primary treatment for myxedema coma? A. Oral thyroid hormone replacement. B. IV administration of thyroid hormone. C. Beta blockers. D. Diuretics. Answer: B. IV administration of thyroid hormone. Rationale: myxedema coma is a life-threatening medical emergency requiring immediate IV administration of thyroid hormone in supportive care. Nursing strategy: recognize signs early and prepare for emergent interventions. Question 20. A patient with SIADH has a serum sodium level of 120 EQ per liter. The nurse knows this indicates A. Hypernatremia. B. A normal sodium level. C. Hyponatremia. D. A level requiring no immediate action. Answer: C. Hyponatremia. Rationale: hyponatremia is a key feature of SIADH as the body retains too much water, diluting the sodium in the blood. A normal sodium level is 135 to 145 EQ per liter. Nursing strategy: monitor neurological status and restrict fluids as ordered. Question 21. What is the function of the hormone aldosterone? A. To regulate blood glucose. B. To regulate water balance. C. To regulate sodium and potassium levels. D. To regulate calcium levels. Answer: C. To regulate sodium and potassium levels. Rationale: aldosterone, a mineral corticoid, promotes sodium reabsorption and potassium excretion in the kidneys. Nursing strategy: monitor electrolyte levels and blood pressure in patients with adrenal disorders. Question 22. Which of the following is a sign of hyperparathyroidism? A. Hypocalcemia. B. Tetany. C. Kidney stones. D. Constipation. Answer: C. Kidney stones. Rationale: the excess calcium in hyperparathyroidism can lead to the formation of kidney stones. Nursing strategy: monitor calcium levels, encourage adequate hydration, and educate about signs of hypercalcemia. Question 23. A patient with pheochromocytoma may experience which of the following? A. Profound hypotension. B. Uncontrolled intermittent high blood pressure. C. Hypoglycemia. D. Bradycardia. Answer: B. Uncontrolled intermittent high blood pressure. Rationale: a pheochromocytoma is a rare tumor of the adrenal glands that causes overproduction of hormones, leading to episodes of severe intermittent hypertension. Nursing strategy: monitor blood pressure closely and prepare for surgical or pharmacological interventions. Question 24. The nurse is providing education to a patient with diabetes about the importance of exercise. Which statement by the patient indicates a need for further teaching? A. I should exercise every day. B. I should monitor my blood glucose before and after exercise. C. I can skip my insulin dose before I exercise. D. I should have a carbohydrate snack if my blood sugar is low before exercising. Answer: C. I can skip my insulin dose before I exercise. Rationale: skipping an insulin dose can lead to hyperglycemia and DKA, especially with exercise. The patient should not skip their insulin dose, but instead adjust it or have a snack to prevent hypoglycemia. Nursing strategy: reinforce proper medication management around exercise and blood sugar monitoring. Question 25. What is the best time for a patient with diabetes to check their blood glucose after a meal? A. Immediately before the meal. B. 30 minutes after the meal. C. 1 to 2 hours after the start of the meal. D. Immediately before bed. Answer: C. 1 to 2 hours after the start of the meal. Rationale: checking blood glucose 1 to 2 hours after the start of a meal provides a good indication of the body's response to the food and the effectiveness of the medication. Nursing strategy: teach patients proper timing for blood glucose monitoring to optimize diabetes management. Question 26. The nurse is caring for a client with hyperparathyroidism. The nurse would monitor for which of the following? A. Cardiac arrhythmias. B. Signs of hypokalemia. C. Hyperglycemia. D. Signs of fluid overload. Answer: A. Cardiac arrhythmias. Rationale: hypercalcemia, a result of hyperparathyroidism, can affect the heart's electrical conduction and lead to cardiac arrhythmias. Nursing strategy: monitor cardiac rhythm and electrolyte levels closely. Question 27. Which of the following hormones is not produced by the anterior pituitary gland? A. Growth hormone, GH. B. Prolactin. C. Oxytocin. D. Thyroid stimulating hormone, TSH. Answer: C. Oxytocin. Rationale: oxytocin is produced by the hypothalamus and is released by the posterior pituitary gland. Nursing strategy: understand hormone origins to anticipate dysfunction in pituitary disorders. Question 28. A patient with hyperthyroidism is at risk for which nursing diagnosis? A. Risk for fluid volume excess. B. Imbalanced nutrition less than body requirements. C. Hypothermia. D. Impaired gas exchange. Answer: B. Imbalanced nutrition less than body requirements. Rationale: the increased metabolic rate in hyperthyroidism can lead to significant weight loss and an imbalanced nutrition state. Nursing strategy: monitor nutritional status and provide high-calorie diet recommendations. Question 29. What is the function of glucagon? A. To lower blood glucose levels. B. To increase blood glucose levels. C. To promote protein synthesis. D. To inhibit the secretion of insulin. Answer: B. To increase blood glucose levels. Rationale: glucagon produced by the pancreas stimulates the liver to release stored glucose, thereby increasing blood glucose levels. Nursing strategy: educate on glucagon use in hypoglycemic emergencies. Question 30. A patient with the pituitary tumor is at risk for which endocrine imbalance? A. Adrenal insufficiency. B. Hyperglycemia. C. Deficiencies in multiple hormones. D. Hyperthyroidism. Answer: C. Deficiencies in multiple hormones. Rationale: a pituitary tumor can disrupt the normal functioning of the pituitary gland, which controls many other endocrine glands, leading to deficiencies in multiple hormones. Nursing strategy: monitor for symptoms of hormonal deficiencies and coordinate multidisciplinary care. Question 31. What hormone does the adrenal cortex primarily produce? A. Epinephrine. B. Cortisol. C. Insulin. D. Thyroxine. Answer: B. Cortisol. The rationale: the adrenal cortex produces corticosteroids, including cortisol, which regulates metabolism and stress response. Nursing strategy: monitor for signs of adrenal insufficiency or excess. Educate patients on stress management. Question 32. Which gland secretes insulin? A. Pituitary gland. B. Pancreas. C. Thyroid gland. D. Adrenal gland. Answer: B. Pancreas. The rationale: the pancreas produces insulin, which lowers blood glucose levels by facilitating cellular uptake. Nursing strategy: educate patients with diabetes about insulin therapy and glucose monitoring. Question 33. What effect does antidiuretic hormone, or ADH, have on the kidneys? A. Increases urine output. B. Decreases urine output. C. Increases glucose reabsorption. D. Promotes potassium excretion. Answer B. Decreases urine output. The rationale? ADH promotes water reabsorption in the kidneys, reducing urine volume and concentrating urine. Nursing strategy: monitor fluid balance and sodium levels in patients with ADH disorders. Question 34. What hormone regulates circadian rhythms and sleep? A. Cortisol. B. Melatonin. C. Aldosterone. D. Growth hormone. Answer B. Melatonin. The rationale? Melatonin is secreted by the pineal gland and helps regulate sleep-wake cycles. Nursing strategy: educate patients about sleep hygiene and the effects of light exposure on melatonin production. Question 35. Which hormone stimulates uterine contractions during labor? A. Progesterone. B. Oxytocin. C. Estrogen. D. Prolactin. Answer B. Oxytocin. The rationale: oxytocin, released by the posterior pituitary, stimulates uterine contractions and milk letdown. Nursing strategy: monitor labor progression and educate about natural hormone roles during childbirth. Question 36. What is a common symptom of hypothyroidism? A. Weight loss. B. Heat intolerance. C. Fatigue and cold intolerance. D. Tremors. Answer C. Fatigue and cold intolerance. The rationale? Hypothyroidism slows metabolism, causing fatigue, weight gain, and sensitivity to cold. Nursing strategy: monitor thyroid function tests and educate on thyroid hormone replacement therapy. Question 37. Which hormone is responsible for milk production in breastfeeding? A. Prolactin. B. Oxytocin. C. Estrogen. D. Prolactin. Answer A. Prolactin. The rationale: prolactin secreted by the anterior pituitary stimulates milk production in mammary glands. Nursing strategy: support breastfeeding education and monitor for lactation problems. Question 38. What is the effect of parathyroid hormone, or PTH, on bones? A. Inhibits bone resorption. B. Stimulates bone formation. C. Stimulates bone resorption to increase blood calcium. D. Has no effect on bones. Answer C. Stimulates bone resorption to increase blood calcium. The rationale: PTH increases calcium levels by stimulating osteoclasts to break down bone matrix. Nursing strategy: monitor calcium and phosphate levels and educate about osteoporosis risk. Question 39. What hormone deficiency causes diabetes insipidus? A. Insulin. B. Antidiuretic hormone, or ADH. C. Cortisol. D. Thyroid hormone. Answer B. Antidiuretic hormone. The rationale: lack of ADH leads to excessive urination and thirst due to inability to concentrate urine. Nursing strategy: monitor fluid status and sodium and administer desipressin as ordered. Question 40. What hormone increases sodium retention and potassium excretion? A. Aldosterone. B. Cortisol. C. Insulin. D. Glucagon. Answer A. Aldosterone. The rationale: aldosterone regulates electrolyte balance by increasing sodium reabsorption and potassium secretion in the kidneys. Nursing strategy: monitor electrolyte balance and blood pressure in patients with adrenal disorder. Question 41. What hormone is released in response to low blood glucose? A. Insulin. B. Glucagon. C. Cortisol. D. ADH. Answer B. Glucagon. Rationale: glucagon is released by the pancreas when blood glucose is low, stimulating the liver to release stored glucose. Nursing strategy: Teach patients how to manage hypoglycemia and the role of glucagon in emergency treatment. Question 42. Which hormone is primarily responsible for the development of secondary sexual characteristics in males? A. Estrogen. B. Progesterone. C. Testosterone. D. Prolactin. Answer: C. Testosterone. Rationale: testosterone produced by the testes is responsible for male secondary sexual characteristics such as increased muscle mass and body hair. Nursing strategy: educate on hormone therapy and monitor for side effects or hormonal imbalances. Question 43. What is the main action of thyroid-stimulating hormone, TSH? A. To stimulate the adrenal glands. B. To regulate calcium levels. C. To stimulate the thyroid gland to produce thyroid hormones. D. To promote growth hormone secretion. Answer: C. To stimulate the thyroid gland to produce T3 and T4 hormones. Rationale: TSH secreted by the anterior pituitary signals the thyroid gland to produce T3 and T4 hormones. Nursing strategy: monitor TSH levels to assess thyroid function in patients. Question 44. A patient with acromegaly is most likely to have an excess of which hormone? A. Thyroid hormone. B. Growth hormone, GH. C. Cortisol. D. Insulin. Answer: B. Growth hormone, GH. Rationale: acromegaly results from excess secretion of GH, usually due to a pituitary adenoma. Nursing strategy: monitor for symptoms of GH excess and prepare for possible surgical intervention. Question 45. What is the role of the hormone progesterone? A. To stimulate uterine contractions. B. To prepare the uterus for implantation and maintain pregnancy. C. To stimulate milk production. D. To promote ovulation. Answer: B. To prepare the uterus for implantation and maintain pregnancy. Rationale: progesterone helps thicken the uterine lining and maintain the endometrium for pregnancy. Nursing strategy: educate patients on hormonal effects during menstrual cycles and pregnancy. Question 46. Which hormone regulates the body's metabolism and energy use? A. Insulin. B. Thyroid hormones, T3 and T4. C. Cortisol. D. Parathyroid hormone. Answer: B. Thyroid hormones, T3 and T4. Rationale: T3 and T4 increase metabolic rate and energy production in cells throughout the body. Nursing strategy: monitor thyroid levels and educate about symptoms of hypo and hyperthyroidism. Question 47. What is a common cause of hypothyroidism worldwide? A. Iodine deficiency. B. Autoimmune destruction. C. Pituitary tumor. D. Excess iodine intake. Answer: A. Iodine deficiency. Rationale: iodine deficiency is the leading cause of hypothyroidism globally because iodine is essential for thyroid hormone production. Nursing strategy: educate about dietary sources of iodine and supplementation if necessary. Question 48. Which hormone promotes sodium retention and potassium loss, leading to increased blood pressure? A. ADH. B. Aldosterone. C. Cortisol. D. Insulin. Answer: B. Aldosterone. Rationale: aldosterone promotes sodium retention and potassium excretion by the kidneys, increasing blood volume and pressure. Nursing strategy: monitor electrolytes and blood pressure, and educate about the effects of hormone imbalances. The hormone responsible for stimulating breast milk ejection is
A. Prolactin. B. Oxytocin. C. Estrogen. D. Progesterone. Rationale: oxytocin causes milk ejection by stimulating the myoepithelial cells of the mammary glands. Nursive strategy: support breastfeeding and educate about the natural roles of hormones in lactation. Question 50. Which hormone deficiency results in diabetes insipidus? A. Insulin deficiency. B. ADH deficiency. C. Cortisol deficiency. D. Thyroid hormone deficiency. Answer B. ADH deficiency. Rationale: diabetes insipidus results from insufficient secretion or action of ADH, causing excessive dilute urine output and dehydration. Nursing strategy: monitor fluid balance, teach patients about medication adherence, example desmopressin, and recognize signs of dehydration.
Thanks for watching NCLEX Made Easy 91, where we make nursing simple and success inevitable. If you found this helpful, hit like, subscribe, and turn on notifications so you never miss your next study boost. See you in the next video.